Hi everybody, this is an informal video regarding insurance agencies, PBMs. There's some interesting news as of January 2025, of course related to the December murder of Brian Thompson, related to an article I made on my website in September of 2024 regarding insurance agencies and PBMs, and then my own personal experience even as, current as today. So this article from Newsweek, United Healthcare charged cancer patients 5,000%. Bombshell FTC report claims. So, context: the December murder of Brian Thompson, CEO of United Health's insurance wing, United Healthcare, has ignited a debate, as we all know. So, what to know, what's new? A new Federal Trade Commission report found that the three largest pharmacy benefit managers, or PBMs for short, have taken in large profits on life-saving medication. That should be new to nobody at this point. This is from 2017 to 2022. So for those 5 years, including during this COVID pandemic, the three PBMs, United Health Group's Optum, CVS Health's CVS Caremark, and Cigna's Express Scripts, marked up prices at their pharmacies by hundreds or thousands of percent, adding $7.3 billion in revenue, the report states. So let's just stop there real quick. Let's go to my website. Wrote this in September of 2024. The hidden costs of PBMs, formularies, and prior authorizations. So, briefly, what are PBMs for the uninitiated? They are third-party intermediaries that manage prescription drug benefits on behalf of the health insurers and Medicare drug plans. So, what happens here? So, I'm a PBM. I go to the company that makes the drug and I say, hey, I will help navigate this drug so that it is on formularies for insurance companies such as Cigna, Anthem, and United Healthcare. As such, you need to provide some sort of rebate or some sort of financial incentive so that I can get your drug out to many people so that it is sold and so that you make money. The drug company goes, yes, of course, I will sell you drug X and I will sell it to you at a 15% discount. The PBMs go, great, take this medication and now give it to the insurance agencies on a formulary as preferred 1, preferred 2, so that physicians like myself can then prescribe that medication with ease and at a lower cost for the patient. That is the proposed incentive of PBMs. So that's all fine and dandy. Probably when it started, that was the incentive. But this is more realistically what happens. Hello, I'm a PBM. You need to give me this medication at a discount or it will not go on a formulary and it will not be sold to patients. Thank you for the 10, 20, 30% discount. Now I will give it to the insurance company on their formulary and subsequently to their patients, but I will not do so at the given discount that you provided. Hence, I'm taking a retention or a rebate retention, which is a significant portion of the drug manufacturer's price, not passing on any of those savings to the customers or to the patients. So as stated here, PBMs may keep a significant proportion of rebates from drug manufacturers instead of passing those savings to insurers or patients. And then they do something called spread pricing, which is even greater. So now with spread pricing, the patient needs to buy this medication to save their life, stop a disease process, fight cancer, reduce heart disease symptoms, whatever it may be. And so the insurance company goes, hey, PBM, I need that medication. The PBM goes, of course, here it is. It's only $2,000. The insurance company goes, fine, I'll pay that. Here's the $2,000. Get that medication to the pharmacy approved so that the patient can pick it up. PBM goes, great, that's fine. Hey, local pharmacy, here's $1,000. We're going to pay you to dispense that medication for this patient. So now all of a sudden, the PBM has made $1,000 spread profit just from that one interaction. So not only are they getting these rebates at the forefront for creating these formularies and leveraging drug manufacturers, insurance companies, and patients, but now they're spread pricing where they actually take the money from the insurance company and take the money that they give to the pharmacy and make money on those transactions. Now these three PBMs we mentioned earlier, United Healthcare Group's Optum, CVS Health, CVS Caremark, and Cigna's Express Scripts. As you can see, these are big chains with United and Cigna having their own health insurance as well. So what happens there is that they're able to leverage their health insurance, they're able to leverage this PBM, they're basically a monopoly on the healthcare system so that they can charge outrageous costs. The PBMs have all the power, the pharmacies that are then navigating these PBMs have no say in what they get, and therefore the patients also have no say and have to pay these outlandish prices. So here's an example. Gleevec, a leukemia drug, imatinib, was collectively marked up by the three providers by 5,232% in 2022. The generic for abiraterone, which is a prostate cancer drug, was marked up over 2,000% and over 1,500% for Medicare. United Healthcare recorded revenue of $372 billion in 2023. They are going to record revenue even higher in 2024. Let's double click on Gleevec really quick. This is imatinib. This is a generic medication at this point. This is a historic medication. Look into imatinib if you're interested in the landscape of leukemia treatment and how this drug was created. So if you go to Mark Cuban's Cost Plus Pharmacy, this is a company that I recommend all patients at least go to once to see if the medication that they're prescribed, whether it's a generic or not, is available for them at these low cash prices without navigating insurance. So as you can see here, imatinib, which is a generic for Gleevec, so it's the same exact medication, is $34 for a 30 count of 400 milligram tablets. Let's do a 90 count of tablets. That's $93. And here's the crazy thing. You scroll down to see the transparent pricing. Your drug cost with us is $93. You save $28,878 compared to the retail price from other pharmacies. I do not need to describe that. That is beyond words, and that is why our healthcare system is so up. If you want to keep learning about this, you can come to my website, but here's insurance formularies and prior authorizations. You can see how the tiers work in regards to how these PBMs navigate the formulary for your insurance company. And then, not to beat a dead horse, but prior authorizations. This is the bane of many physicians. We order a medication, we know it's the right medication for our patient, insurance companies immediately deny it using software and AI, and then require legions of staff to put in paperwork, to put in claims, just so that our patient can maybe get the medication. Sometimes this takes weeks, if not months, with significant confusion between the physician, the patient, the insurance company, and the pharmacies, which delays care, makes patients frustrated, leads to abandoned treatments. It's horrible for the system. It's horrible for patient care. If you want to learn more about it, you're more than welcome to come to my website. I told you about Cost Plus Pharmacy, which is a great alternative. You can use GoodRx, which does navigate some PBM architecture, but it can provide you significant cost savings. So at this point, it's a necessary evil. We have compounding pharmacies that are available, particularly in dermatology. For example, you can go to my website and you can see that there's a compounding pharmacy that I work with, that I trust, that's made by dermatologists, that provides thousands of dollars of ingredients that insurance would never cover. And if they covered, it would cost the patient thousands of dollars. We can get it to them for less than $100, and it's amazing for our patients and a great value for them. But this is just another great example of what's going on in this healthcare system, why people are fed up, and why US healthcare is not sustainable and needs to change. That's my spiel. Thank you for watching. If you found this was interesting, please share it. It helps my channel, and I like to get this information out to as many people as possible. If you have any stories about how the insurance company has affected you and your medical care, feel free to comment. I will take these comments, I will navigate them, I will provide some science behind them, and I can help spread the word regarding this injustice more and more. Have a nice day.